Working on the posterior leg isn't anything super complicated, and we've covered pretty much all of the parts of the hand and arm that are comfortable and safe to use. So all we're going to basically do is quickly look at which of them I think fits this area the best, and a couple of ways to sort of position yourself to do that, and then let you guys play with it. Grasping techniques are super common, and I do some grasping on legs, but they are thumb intensive. So those are techniques I tend to stick with purely as a warm-up kind of gentle technique. If I need to apply more pressure, I'm going to switch tools. I'm a huge fan of that fifth metacarpal head. If you haven't figured that out, you've been asleep. So I use that here on the hamstrings quite a bit. I like to start distal and work proximal, but you can do it a lot of different ways. So I'm going to be finding essentially the biceps femoris tendon here as it rolls around the posterior leg, applying pressure through that fifth metacarpal head and tracking straight up the muscle all the way up to the ischial tuberosity. Just like that. This can be done as fast or slow as your patient and you are comfortable with. I also like to lengthen and shorten muscles while I work them, so I will sort of pump the lower leg while I'm making that pass. If that's too much, let me know. It takes a little bit of time to get comfortable feeling through that fifth metacarpal head enough to stay where you want it to, but you'll get the hang of it pretty quick. So that's our lateral hamstring muscle, the biceps femoris. We have the semitendinosus and membranosus that are on the medial side. And what I usually do for that is switch hands and come into that medial aspect of the knee, not usually sitting down. And the same basic idea of tracking up. Ooh, that's the tight one on her. If somebody has had knee surgeries, obviously you're going to be careful with how far you flex the knee. Don't force it. We don't want to bend it all the way up to the hip and hurt somebody if they've had an injury. But some folks like to try to do the opposite, where they start with the leg bent up, cram that knuckle down in here, and slowly let the leg down. I find that works really well on this side. I can't really get a good position to do that on the medial side. I suppose you could go to the other side of the table if you really wanted to, but I don't tend to mess with it. But if you want to play with that, just start with it bent and let the leg come down as you work up. So, easy enough. Rolling the way we were on the other parts of the body can be done in here. I don't tend to do it so much on the lower leg, but for the upper leg, you can certainly get in and make that rolling motion. Just be gentle. The hamstrings can be pretty tender. So that's an option for that fifth metacarpal head as well. Another tool that I use a lot in the hamstrings is the pip joints, particularly right at the very top. So where we're strumming across essentially the hamstring tendon, the common tendon for them, where they grab the ischial tuberosity. So I'm going to make that same fist. I'm going to be right way up at the top of the leg, just medial to that tendon, applying that pressure, and then strumming across just like that. And if that's too much, just let me know. In some cases where there's been a medial hamstring injury, you'll get a twang as you strum across it. But it's also possible to get muscle fasciculations anytime you're working a muscle. So if you see the muscle fire, while you're working, that's okay. Just make sure it's comfortable for the person. If you like that strumming technique, it can also be applied all the way down both the medial and lateral sides of the hamstrings here, back and forth. Just, modulate your pressure and communicate with your patient. We don't want to hurt anybody. If there are specific spots, if you come through and you find, like on her medial side, there was that one area that was really taut, that can be used for static pressure, just applying pressure in there. Again, I'm not usually sitting down. That second pip joint is also wonderful for particular points. So I can come in and find that spot, apply that pressure. Easy enough. But if I'm doing static, generally in this area, I switch over and start using my elbows. I like to do that as much as possible. Same musculature, same areas, so I can bring my elbow in more bent or less. Again, I like that contact with the hand, just like we were doing in the back. In the upper portion here, near the ischial tuberosity, you can lay the arm down horizontal and have your pressure be more longitudinal up towards the pelvis. And because I like to move, a lot of times I'll gently rock that back and forth across the tendon there. If we're working that spot that was tight down here, you can move the elbow in, apply pressure. If you're a fan of moving, you can gently shorten and lengthen those hamstrings while you're doing that. It's easy enough. Just hope your patient doesn't have stinky feet. The mask has its benefits. Put an Altoid in your mouth, put your mask on, you're good to go.
That feels amazing.
Good deal. So the elbow is fair game, just not directly in the back of the popliteal fossa here. We don't want to do any damage. The artery is pretty superficial there, so use some common sense. If somebody has pain in the back of the knee, that there's really only a couple of muscles that could be involved, and it's pretty tough to treat either of them at the back of the knee. Popliteus is the one that usually is involved, and it's easier to treat lower anyway. One thing we didn't do in the back that we could have is something called Shanghai rolling. It's just supination and pronation. You're basically just using the forearm as a roller. And that can be done here in the leg just as easily as it can in anywhere. It's essentially just pressure with that ulna and rolling the flexor and extensor compartments back and forth. It's useful sometimes in the leg, but you have to be careful you're not slapping people on the backside. So, you know, it doesn't matter which hand you're using, you just want to make sure that that roll isn't running into anything you're not supposed to be working that way. So I find that is more kind of useful as just a gentle warm-up or finish-up kind of technique. It doesn't tend to have a lot of really heavy pressure. Honestly, I don't use it in the leg as much as I do the low back, and I use it in the low back more to stretch muscles, so I'm pushing rather than the roll part, just because I don't think it does all that much other than just a light fluffy. That's the I want a relaxation massage technique. Oh, I can do that all day long. There's nothing wrong with that. It's a good technique.
Great on the lower leg, though. I use that one a lot.
Do you? I don't tend to, but there's nothing wrong with it. Anywhere you can work. Just make sure you're not crushing their foot down into the table.
Is there any contraindication for varicose or spider veins or anything like that?
No, you're not going to cause any major problem with those. I mean, I wouldn't go in and try to like drain them manually, but the incompetent valve that leads to them isn't going to change. So even if you got them to look smaller temporarily by flushing it out, it's coming right back. Most of the time, if it's bad enough that it would be a problem, they're already on blood thinners to make sure that clots aren't forming, and so you're fine. However, if you're working on someone and their calf is swollen, warm, and there is a nodule present anywhere in the middle of the calf, stop working on their leg. Deep vein thrombosis is a problem, DVTs. Almost all of them are palpable. The leg will palpably be warm, and you will find a knot in the leg because it's so inflamed around that nerve artery bundle. However, they're not always that way. But if there's any suspicion, if the leg is really inflamed, obviously the characteristic of a DVT is that they've suddenly been less active. People who are always inactive have less chance of actually having a DVT than people who are normally quite active and suddenly have a period where they're sedentary. That's why long flights are always talked about as the characteristic, because it's somebody, you know, runs miles every day and is busy and doing things, but then they're on a 22-hour flight overseas and sitting the whole time. But it can happen to lots of folks. So be careful of DVTs. Those are a problem. The other area that I tend to work with the upper leg is the adductor compartment. I'm a big fan of treating adductors. They get skipped by a lot of massage schools because this is groiny area, and I don't want to work on groiny area stuff and have people complain. But I have people who have tons of pain coming from the adductors. Adductor longus is actually the most commonly injured adductor muscle, but I seem to attract people with adductor magnus problems that are easily accessed in this prone position. But any of the adductors can be treated. For adductors, I really like these pip joints. They're a great way to get in there, and I don't really have to worry as much about fingers and such towards the groin because my hand's curled up and I can come quite high up in the leg. I can stabilize the leg with my other hand and just drag these gradually down those adductors. If that's too much, let me know. If I need more lotion, let me know. If you're into moving the leg around, you can certainly lift the leg up. It doesn't actually do anything for the adductors, but they do help with medial rotation. So you can gently rotate the leg out while you work, and then gently rotate the leg in. Again, I don't normally do this seated, but just like that.
Woo-hoo! I'm sorry, I felt that one.
That's okay. I always tell my patients to scream before they kick. Let me know. Intense is okay, painful is not. I don't want to hurt you, but definitely let me know if it's too much. So the pip joints are a great tool there as well. You can do lots of things for the adductors, but in this position I find the pips are the single best tool. When we flip over, if the leg is able to be laid out in that Faber or figure 4 position, then we can get in there with some other tools. But for now, we'll just stick to the pips.